Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 15 of my multi-part video series providing a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to open up talking about diaphragm paralysis. So, paralysis affecting half of the diaphragm can occur due to injury or surgical cutting of the phrenic nerve on the same side. This condition is identifiable through radiological means, as shown on the picture on the right. Additionally, there is a paradoxical movement observed where the dome of the diaphragm on the affected side is pushed upward by abdominal organs during inhalation, rather than descending as expected. Next, I'd like to move on and talk about diaphragmatic ruptures. Injuries to the diaphragm are uncommon and typically stem from either blunt or penetrating trauma. Currently, 80 to 90% of blunt diaphragmatic ruptures are attributed to motor vehicle accidents. The left side accounts for the majority, 80 to 90% of these injuries. Blunt trauma typically results in sizable radial tears ranging from 5 to 15 centimeters, predominantly located at the posterolateral aspect of the diaphragm. Posterolateral aspect. Moving on. Well, before we move on, actually, as you can see in the radiological image here, you can see the rupture occurring. So hope this helps you guys visualize what's occurring during a diaphragmatic rupture. Moving on. Next, I'd like to talk about cardiac hypertrophy. Enlargement, also known as hypertrophy, of the left atrium due to mitral valve failure can exert pressure on the esophagus, leading to symptoms of dysphagia, difficulty swallowing. This compression may be detected as a filling defect in the esophagus during a barium swallow examination on lateral thoracic x-rays. As you can see, we have a normal heart on the picture on the right, and then we have a heart undergoing right ventricular hypertrophy as well. And you can see the differences in the ventricle wall. The one undergoing hypertrophy seems to have a larger ventricle wall compared to the one on the left. Moving on, let's go look at some questions. Which of the following conditions can result in paralysis affecting half of the diaphragm, leading to a paradoxical movement observed during inhalation? Pretty first order question from all the information I presented to you guys, so I'm just going to go ahead and move on now. If you need more time, please feel free to pause the video. Otherwise, moving on now. Paralysis affecting half of the diaphragm can occur due to injury or surgical cutting of the phrenic nerve on the same side. The phrenic nerve innervates the diaphragm and plays a crucial role in its contraction during inspiration. When the phrenic nerve is damaged on one side, it leads to paralysis of the corresponding half of the diaphragm, resulting in impaired movement of that portion during inhalation. This condition can be identified through radiological means such as chest x-rays or fluoroscopy. Therefore, the correct answer is C, injury or surgical cutting of the phrenic nerve on the same side. Let's go ahead and see why the other answer choices are incorrect here. So compression of the recurrent laryngeal nerve primarily affects vocal cord function and can lead to hoarseness of voice, not paralysis of the diaphragm. Injury to the vagus nerve may result in impaired swallowing, voice changes, and gastrointestinal motility issues, but does not directly affect diaphragmatic function. Injury to the glossopharyngeal nerve can cause difficulty with swallowing and loss of taste sensation, but it does not innervate the diaphragm. Compression of the accessory nerve primarily affects the function of the sternocleidomastoid and trapezius muscles, leading to weakness or atrophy in those muscles, but does not affect the diaphragmatic function. Let's go ahead and move on to the next question. Which of the following statements is true regarding injuries to the diaphragm? Once again, pretty first order question, so I'm just going to go ahead and move on now. If you need more time, please feel free to pause the video. Otherwise, moving on now. Injuries to the diaphragm are uncommon and typically stem from either blunt or penetrating trauma. Currently, 80 to 90% of blunt diaphragmatic ruptures are attributed to motor vehicle accidents. These injuries predominantly affect the left side of the diaphragm, 80 to 90%. Blunt trauma to the diaphragm usually results in sizable radial tears, ranging from 5 to 15 centimeters, predominantly located at the posterolateral aspect of the diaphragm. This pattern of injury is due to the mechanics of blunt trauma, which tend to exert forces on the diaphragm at its weakest points. Therefore, the correct answer is E. Blunt trauma that typically results in sizable radial tears, predominantly located at the posterolateral aspect. Let's go ahead and see why the other answer choices are incorrect. Blunt diaphragmatic ruptures are more commonly attributed to blunt trauma, not penetrating trauma. Penetrating trauma may result in localized injuries, but blunt trauma is more likely to cause radial tears. Blunt trauma to the diaphragm usually results in sizable radial tears, not small linear tears, and those tears are predominantly located at the posterolateral aspect, not the anterior aspect. Motor vehicle accidents are the leading cause of blunt diaphragmatic injuries, not penetrating diaphragmatic injuries. Penetrating injuries may result from gunshot wounds or stab wounds, but are less common compared to blunt trauma. The left side of the diaphragm accounts for the majority of injuries in blunt trauma, but not the right side. This is due to the protective presence of the liver on the right side, which reduces the likelihood of diaphragmatic injury in blunt trauma involving the right side of the thorax. Okay, let's go ahead and move on to the next question. Which of the following statements is true regarding injuries to the diaphragm? Once again, pretty first order question, mainly recall from the third slide that I covered earlier. So if you need more time, please feel free to pause the video. Otherwise, moving on now. Enlargement, hypertrophy of the left atrium due to mitral valve failure can exert pressure on the esophagus, leading to symptoms of dysphagia, difficulty swallowing. This compression may be detected as a filling defect in the esophagus during a barium swallow examination on lateral thoracic x-rays. Therefore, the correct answer is C, hypertrophy of the left atrium. Moving on to see why the other answer choices are incorrect. Enlargement of the right ventricle typically does not exert direct pressure on the esophagus to cause dysphagia. Right ventricular enlargement is more likely to cause symptoms related to venous congestion or right heart failure. Aortic valve stenosis leads to obstruction of blood flow from the left ventricle into the aorta, but it does not directly affect the left atrium or exert pressure on the esophagus to cause dysphagia. Pulmonary artery hypertension results in increased pressure within the pulmonary circulation, primarily affecting the right side of the heart. It does not directly impact the left atrium or cause compression of the esophagus to induce dysphagia. Constrictive pericarditis involves scarring and thickening of the pericardium, which can restrict cardiac filling and lead to systemic venous congestion. While it may cause dysphagia indirectly due to venous congestion, it does not exert direct pressure on the esophagus as seen in left atrial enlargement. So that will do it all for today's video, guys. Would appreciate it if you could leave a like and subscribe to the channel. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. Otherwise, this is FixerMed signing off. Goodbye, good luck studying, and have a good day, everyone.